Hola amigos, feliz viernes. Hoy es viernes. Yo soy Rory. Estoy contento estar aquí contigo. So today we're talking about the 3 P's of nursing. So en el hospital, the 3 P's are pain, potty, and position. Correcto? So like always, let's get started with some brief vocabulario and then we'll jump into each topic. So when it comes to pain, we've got el dolor. That's the noun for pain. So the thing, the noun, right? Pain. The verb dolerle is the verb to hurt. So it works a little bit different than most verbs in that it works like the verb gustar. You don't say literally, I like apples. You say apples are pleasing to me. It's a little complicated, but here's how we ask the question. Le duele. Le duele la cabeza, le duele el abdomen, le duele la espalda, le duele la pierna. So do these different body parts hurt you? So it's like body part hurts you, basically. And your patient might respond with something like, sí, me duele la cabeza, me duele el abdomen, me duele la espalda, me duele la pierna, etc. Okay? All right, potty. Moving on to potty, talking about bathrooms. Usar el baño is an easy verb to just use the bathroom. Orinar, the verb to urinate, orinar. And defecar o mover los intestinos is a good word for saying poop. Now, you in some other contexts, you might hear someone say hacer popo or hacer popo. People pronounce it slightly differently. But that's kind of like poop or poopy, perfect for kids, right? Hacer popo, hacer popo. And position. Mover a, so move to another place. Moverse is just to like move around, okay? Elevar, to raise. Bajar, to lower. And cambiar de posición, change position. Okay, so we've got pain, potty, and position, some basic vocabulario. Before we dive into each of these, let's take a look at some presentaciones breves, just some brief little introductions to your patients, okay? Con permiso, you knock on the door, you walk in, you cross the threshold. It's super appropriate and culturally appropriate to say con permiso. It's like saying with your permission, okay? You'll hear it all the time if you're entering into people's homes anywhere in Latin America, that kind of thing. Coming from outside into their home, con permiso. It's a polite thing to say as you come into their space. Hola, señor or señora, last name, right? Señor y señora go with last names. Soy Rory, su enfermero. I'm Rory, your nurse, yeah. ¿Cómo le puedo ayudar hoy? How can I help you today? I added the today, but we've got hoy as a possibility for today. ¿Cómo le puedo ayudar esta mañana? How can I help you this morning? ¿Cómo le puedo ayudar esta tarde, this afternoon? ¿Cómo le puedo ayudar esta noche, this evening? And este turno, this shift, yeah? Bien. All right, continuamos. Cuando quiere, when you want to. Cuando quiere bañarse, when you want to bathe. Cuando quiere levantarse, get up. Cuando quiere salir de la cama, when you want to get out of bed. Cuando quiere cambiar de posición, when you want to change position. Cuando quiere usar el baño, when you want to use the bathroom. All right? You got it. Use el botón de llamada. Use the call button, yeah, the call light, para que yo le pueda ayudar, so that I can help you. Es importante prevenir las caídas. Prevenir, prevent. So it's important to prevent, can you guess what las caídas are? Falls. It's important to prevent falls. Okay, so we've got just a little brief introduction here, okay? Let's get going with el dolor, our first P, okay? ¿Cómo se siente? How do you feel? ¿Cómo se siente? How do you feel? Tiene or siente, so do you have or do you feel dolor en este momento? Do you have or do you feel any pain in this moment? ¿Cómo está el dolor esta mañana, esta tarde, esta noche? So how bad's the pain this morning, this afternoon, this evening? ¿Cuánto le duele en una escala de 0 a 10? So how bad does it hurt on a scale of 0 to 10? You could change that 0 to 1, uno, if you prefer to use 1 to 10, okay? ¿Necesita medicina para el dolor? Do you need medicine for the pain? La medicina ayuda o alivia el dolor. Basically, is the medicine helping or alleviating the pain? There's a lot to talk about with pain, and in fact, we've done multiple lessons on it, but here's an easy link to the information about pain, both talking about intensity and type of pain. So if you've got the downloaded notes, go ahead and just click on this link and you'll head over to this other blog post all about talking through pain and how your patient's feeling. By the way, if you're learning something new right now, make sure you like this video, subscribe to our YouTube channel. That's how we are able to be in front of more people and be able to continue giving these free lessons. Okay, moving on to potty. Usar el baño, just using the bathroom, yeah? So when it comes to using the bathroom, you might want to talk about some things or communicate some things about how you need to help them or can help them, and then also some things you might need to do with their waste, right? So as far as ayuda goes, help goes, cuando necesita ir al baño, and we've seen some phrasing like this before, favor de usar el botón de llamada, please use the call light para pedir ayuda, to ask for help. Es muy importante pedir ayuda para prevenir las caídas. So it's very important to ask for help to prevent falls. Now, checando la orina, so checking the urine, if you have to do any sort of urine measurements or whatever, okay? También necesito medir, I also need to measure cuánto orina, how much you're urinating. Or necesito medir la cantidad de orina que produce. I need to measure the amount of urine that you're producing. Favor de orinar en la bacineta. So please pee in the bedpan. Or el orinal de la cama, 2 words, la bacineta, el orinal de la cama, para poder medir la cantidad, so that I can measure the amount. Checando las deposiciones. So you're checking the stools, poop, okay? Or asking about it anyway. ¿Cuándo fue la última vez que movió los intestinos? When was the last time that you moved your intestines or you had a bowel movement, basically? ¿Cómo era el excremento? What was the excrement like? Duro, was it hard? Suave, soft? Acuoso, was it watery? Había, was there, or tenía, did it have sangre en el excremento? So blood in your stools? Okay, so that's potty. Posición, moving to la posición. Some preguntas básicas. ¿Está cómodo or está cómoda? Are you comfortable? ¿Quisiera moverse? Would you like to move? And quisiera is a nice, really polite way of saying, instead of do you want to, it's would you like to, okay? ¿Necesita moverse? Do you need to move? ¿Preferiría moverse al sillón? Would you prefer to move to the chair? And sillón, maybe you've heard the word silla before. Silla is like just a standard chair. Maybe it's wooden or whatever. Sillón's like one of those comfy chairs, you know, like maybe like an armchair. Es importante no moverse solo. It's important not to move on your own. Es importante no bajar las barandillas de la cama. It's important not to lower the rails of the bed. Es importante pedir ayuda cuando quiere moverse. It's important to ask for help when you want to move. Puedo, I can, or necesito, I need to, ayudarle, I need to help you, or I can help you, cambiar de posición, change position. Levantar la cabeza, raise your head or elevate your head. Elevar las piernas, raise your legs, elevate your legs. Okay? Usted puede, you can. Usted puede controlar la cabeza y el pie de la cama. So you can control the head and the foot of the bed, right? Controlar la tele, control the television, etc. Okay. Possibly, that's the 3 P's, pain, position, and potty, or pain, potty, and position. You might have a couple of other or many other things to discuss with your patients, and I thought just communicating some other details, one more slide to help with a few things. So, voy a terminar mi turno pronto. I'm finishing my shift soon. Hasta luego. See you later. Buena suerte. Good luck. Que esté bien. Be well. Que Dios le bendiga. God bless. Nos vemos. We'll see you later. Bien. And so, sort of taking leave or saying your goodbyes to your patient. El doctor, la doctora pasará, and the doctor will be by in, I don't know, unos minutos, a few minutes, unas horas, a few hours, en la tarde, in the afternoon, en la noche, in the evening. And si todo sigue bien, if everything goes well or continues well, si los resultados son positivos, if the results are positive, si los resultados son negativos, if the results are negative, si hay un cambio, if there's a change, vamos a conversar sobre los próximos pasos. We're going to talk about the next steps. Could be an option to finish some of this. Vamos a transferirle. We're going to transfer you to otro piso, another floor, otro departamento, another department. Vamos a darle el alta. We're going to discharge you. Esta tarde, this afternoon maybe, or esta noche, this evening, mañana, tomorrow, en particular number of days. Okay, bien, so a handful of detalles para comunicar. Of course, you probably automatically can think of 10 different vocabulary words that you might need to finish or add to some of these sentences. So go ahead and put them in the comment section. We'll be happy to help you with them. Okay? All right. Apart from that, you've got to be practicing this information. So, para conversar, think of a couple common patient scenarios in the hospital and introduce yourself to your patient. Okay? Ask about and address the 3 Ps as naturally as you can. And finish with a few additional details for the patient. Now, this is with your conversational partner, right? So get together with your partner and think of some common scenarios to both your patients and his or her patients, and then practice introducing yourselves, asking about and addressing the 3 Ps, and then finishing with a few additional details. Okay, and together you might be thinking of other additional things you want to say, and feel free to just comment on those below in the chat area. We'll be happy to help you with them. And of course, if you don't have a conversational partner, but you need one, head over to the Learning Medical Spanish Facebook group, put yourself out there and say, hey, I need a conversational partner. I want to practice the 3 Ps of nursing in Spanish. Okay? Preguntas, make sure you post the questions in the comment section below. And before you go, please do like the video, subscribe to our YouTube channel so we can keep doing this on a weekly basis. All right, amigos, gracias por aprender español conmigo. Juntos mejoramos comunidades. Together we really do improve communities. For more Spanish, head over to the website, commongroundinternational.com. And if you want to take as many free medical Spanish terminology tests as you like, head over to Certified Spanish, create your free account, and you can take as many medical Spanish terminology tests as you would like. All right, amigos, hasta la próxima semana. Ciao.